In the late 1960s, the Catawba County Board of Commissioners and a group of community leaders had the vision to build a community hospital to serve the people of the Catawba Valley. During the early years, the leadership of the hospital grew with the facility and in 1972 added a visionary chief nursing officer to lead the hospital to the forefront of modern care.
Marjorie Adams, who hired me, set the tone for nursing in this organization, and she set a standard that we would have more registered nurses than any other hospital in the region. And she always had a belief and a philosophy that the higher the level of education, the higher the opportunity that patients would get the right care.
The idea is for the patient to receive better care, always along the way. And I remember a couple of times going and suggesting something to Mr. Case very early on. And he'd say, well, where are they doing that? And I'd have to say, nobody's doing that. Well, you know, do we want to be first? Do we really want to try that? And I never could figure that anything was wrong with being the first one to try.
During her tenure, Adams put in place many new concepts in nursing practice and mentored many nurse leaders, including Eddie Beard. When Adams retired in the mid-90s, Beard would carry on the legacy of innovation and leadership in nursing. The developing culture would ultimately lead Beard to identify a new goal for the hospital.
I went to a seminar and learned a little bit about Magnet, and I thought, you know, it was just the standards were being published and had just been published, and very few hospitals were on that journey. And I read the standards, and I said, we're doing all these things already.
Around 1999, Eddie Beard, who was our chief nurse officer at the time, came to the nurse leadership group and said, you know, let's do this Magnet thing. I've done some reading, and it actually defines us rather than we defining Magnet.
When Eddie first proposed we become a Magnet hospital, he brought us all into a room and he presented it, and we all sat there just very quiet with long looks on our face. And he said, am I going to get a response? Is anyone going to say anything? No one in the room made a comment, said anything. He said, I tell you what, we're going to come back together in a couple weeks. I want you to go away and think about this and see if this is something that you think is an organization that we could accomplish. When we came back for our meeting, everyone unanimously at the table said, we've got this.
In 2001, Catawba would achieve its first Magnet recognition from the American Nurses Credentialing Center, setting a course for continued growth of the Magnet culture in the hospital.
Magnet status is not something that you can just go by. It's not something that you can transfer from corporate headquarters out through a hospital or healthcare system. I think it's kind of like making a cake. The ingredients have to be there. And in the beginning, Eddie Beard realized that we had the ingredients, we just had to put it all together in the right bowl and work through the process.
You know, Magnet status is ongoing. We have to stay in constant readiness and make it a part of our culture, because we want to make sure that we are setting standards, not just meeting the standards, and also making sure that our care is evidence-based and is the best standard for our patients so that we continue to have good patient outcomes.
When she was in clinicals at other hospitals, she would come home and she would talk about her day and talk about the nursing staff and the differences that she saw at other hospitals compared to Catawba. And I would tell her that's the difference between a Magnet culture and a non-Magnet culture.
It's in everything we do. We eat, breathe, sleep it.
Magnet is always on your work task. It's always a sidebar. You have to constantly reflect it in everything that you do.
Just coming to our hospital on clinical rotations, the new nurses know a lot about Magnet, and it brings them to our facility, so we get the best and the brightest talent right off the bat.
With redesignations in 2005 and 2010, the culture grew as leadership continued to focus on the areas most important to the Magnet culture.
The body of knowledge is growing constantly. And keeping practice up to date with that body of knowledge is what's best for any healthcare delivery.
Magnet for me has made me a better nurse by thinking more along the lines of patient outcomes. What's going to happen in a week from them being discharged from the hospital, what's going to happen in 3 months from them being discharged from the hospital, and what's going to happen in a year.
It's odd, I think, now to speak with nurses who are not interested or not in school or not getting ready to graduate. I know in my department, in the past 2 years, well, last year and this year, we will graduate 15 nurses with a higher degree.
When we say support to go back to school, it's a financial support. We're working with their schedule support. We give them all the resources that they need to be able to achieve that goal.
We actually have nurses with master's degrees that are practicing at the bedside. So these are things that as we have moved forward with Magnet, we are actually raising the bar. And that's what Magnet's doing for us. It's raising the bar.
I was able to work, have a family, and be able to go back to school, all because of your leadership that supports the Magnet culture here.
If nurses understand the EBP process, it can stimulate thought. It can stimulate just desire to learn more, and I think that goes to the bedside, to the patient directly.
Making sure that the practices are based on the best evidence then means that the quality of care that can be provided to patients is the best.
With research, you know, there's better ways that we can care for our patients. And so I think our patients benefit by us having that knowledge, by having a program here and promoting research and evidence-based practice.
We started a research project working with our evidence-based practice, and we showed the outcomes that having CO2 monitoring available was actually best practice. We worked with Dr. Tart. She gave us the research, and we took it, and I was able to get it approved for our different areas that we do moderate sedation in.
I think the shared governance is very important to the hospital because it gets the nursing and other staff's input on making decisions, you know, pertaining to what they do. So, you know, to get them involved as much as possible with organizational decisions.
It encourages me to be an early adapter for change. So when we are changing our practices on how we take care of our patients, I know why we're changing.
The systems that we have put in place, we see every day in the increased professionalism of our staff. And certainly that translates to the outcomes of our patients. It is a constant effort to raise the bar.
It makes me a better nurse and a better director, just knowing that I have that support and that everyone cares about the same thing and has the same goal in mind.
Over the years, staff has advanced in their practices and leaders have emerged from within the organization.
Without Magnet status here at Catawba Valley Medical Center, I don't know that I would be where I'm at professionally today. I think having the mentoring here that we have, you want to do it. You want to be there. You want to be better. You want to rise up. So I think it's truly impacted who I am as a nurse, as a caregiver to patients, and as a leader.
If I were at a different organization, I don't think I would be where I am at today. It takes more than just self-motivation. You have to have the support, you have to have encouragement, and you have to have outside motivation. And this hospital has done that for me.
I am very blessed and lucky to work at a Magnet facility that puts such a high value on its nursing.
We're all high achievers, and so you just keep rolling with the punches and just keep achieving the best that you can be.
I was the captain. It was my job to relay to them, you know, our numbers. You know, we're great nurses. It's easy to say that, but we need to explain why we're great nurses, why our care is better than other hospitals and other facilities.
I asked her why did she appoint me to represent our team here on surgical unit, and she says because I got along with everybody and I was positive and just was a team player and did whatever possible for positive patient outcome. So it was such an honor to be chosen.
Even as Catawba celebrates a 4th Magnet designation, leaders and staff prepare for the next application process.
That's one thing we discovered after our first designation. We just took a big deep breath and went, oh, thank goodness. And before we knew it, it was time to apply again, and we've learned that now we say, congratulations, job well done, everyone, and we start again.
The goal that I have set as the project manager for the next application is to keep Magnet ongoing in the face of staff 24/7, every day of the year, not just when we have to write the application.
Moving forward, Catawba Valley Medical Center embraces the Magnet philosophy of continual improvement in practice and patient care as we strive to provide the best health care for the communities we serve.
I think that having a Magnet designation, particularly the fourth one, it shows to the public that our organization is committed to nursing care and to the patient's outcome.
Yeah, there's not a lot of hospital shopping once you've been here. You are very happy with the care, you're very happy with the nurses, you're very happy with the providers that you see, and families and patients really like that and do come back.
It's rewarding as a provider to hear that kind of feedback from families that say, well, you know, I was born here, you know, when I was a child I had surgery here, and now they have their children here and they bring their children. And so it really develops a relationship between the staff and the organization and the community that I've never seen anywhere else where I've worked in healthcare.
We always tell our nurses, if it was you in the bed, if it was your family member in the bed, how would you want them to be treated?
I think I've always wanted to be a nurse. I just saw how happy she was at Catawba and how they supported her, and she always seemed like she enjoyed her job, and it really made me want to do that and be a nurse at Catawba.
It's really rewarding when you see patients outside of the hospital and they're like, you guys did such a good job, and they're so thankful and grateful for what we've done for them.
Catawba is like a family. And you asked me why I wouldn't go anywhere else, and that's one reason, is because I feel like this is my family.
And when I left the military in 1992, I was really looking for a home. And I worked at another area hospital for a few years. And when I came to Catawba Valley Medical Center, it was the first time in my life I'd been at an institution and say, well, this is where I want to stay till I retire. And that's going to happen.
You know, I've been doing nursing. I don't know anything else I would rather be doing than being a nurse. Being a nurse at Catawba Valley Medical Center, I don't know another place I would rather be or anything else I would rather be doing.